Hi everyone, it's your girl again, Bola Tito Fatoki at Spedeveryday. I'm so happy to be here. You know, it's another Friday, beautiful one, and we're here to learn. Remember, I told you last week while I was talking about ADHD in children, I said we're going to be having a guest expert today, and that is Dr. Faloye. She's here with us today. Dr. Faloye, she obtained a Bachelor's of Medicine and Surgery at the University College at the University of Ibadan, I'm sorry. She's currently a senior registrar at the Department of Psychiatry at the University College Hospital in Ibadan, Oyo State, Nigeria. Our area of interest include general adult psychiatry, forensic psychiatry, women and young people's mental health. Dr. Faloye, she's a passionate mental health advocate, lending her voice to mental health education and promotions in schools, religious organizations, and the media in its various forms. She also desires a Nigeria where conversations around mental health is commonplace, such that no one will be ashamed to discuss their mental health challenges. Now you see who have brought on for you today. So when we talk about ADHD and Dr. Faloye is saying something about it, know you're hearing from the expert and someone with so much passion. And like I always say, when it comes to mental health, special education, you need to have the passion. If not, you know, it's not really going to flow and it's not going to go out there. So she's here today to give us her expertise on ADHD. Good evening, Dr. Faloye. How are you doing today?
I'm fine. Thanks for having me. I'm glad to be here.
Thank you so much for joining us. I know I have to take you out of your regular schedule, and I know it's something you like to do.
It's a pleasure. Anything mental health excites me. Trust me.
Thank you. Thank you so much. So today we're going to be discussing about ADHD in adults. I'm sure you still have to refer to maybe children and all that. But I would like you to tell my audience what actually is ADHD.
Okay, thank you. ADHD is the shortened form of attention deficit hyperactivity disorder. And it is one of the developmental disorders in that it happens from childhood, although most times it is not usually identified until when the child is a bit older. So the characteristic thing about attention deficit hyperactivity disorder is that the individual who suffers from this disorder usually have problems with attention.
Okay.
They cannot focus easily. That's the meaning. Attention deficit. They are deficient in attention, deficient in focusing. And the other part of it is hyperactivity. So they are very hyperactive, restless. So those two words clearly tell us what it is all about if we just break it down using the two words. So that's just the summary of what ADHD is.
Thank you so much. Thank you. So, like you said it. You may not identify it as a very young age. So the child will be like a little bit grown up before they do. But is it possible?
Well, yes. Yes, because most times it would have happened before the age of 3 most times, but they will not pick it until like maybe age 7 when the child now goes to school.
Oh,
right.
Okay, so at first parents may think it's like the child is growing or maybe in a naughty 2 kind of thing and all that.
Exactly. Troublesome 2, troublesome 3, difficult child, naughty child, disobedient, stubborn. Those are some of the words they will use to describe the child.
Exactly. So let me ask, is it possible that a child does not have it, but maybe when you're 21 that you develop this ADHD, or it has to be from childhood?
It is uncommon for people to develop ADHD in adulthood. So if you find an adult who has ADHD, by the time you take the history, you realize that the symptoms had been there since childhood. So it's probably just coming to attention, maybe because the individual himself or herself read about it or has been worried about why he or she has some of these issues. Maybe people, it's been there since childhood. It just never came to attention until adulthood.
So my question now is that what causes ADHD?
Okay, so I was trying to say that in terms of when we talk about mental health issues, mental health challenges, we are very cautious with the use of the word cause.
Okay.
So we usually talk about risk factors because
Oh.
yes, a lot of things come together to lead to those challenges such as ADHD. It's not
Mm.
just one thing. So the word cause, we are very careful with it. So for ADHD, there are a number of risk factors. We talk about genetic factors.
Okay.
That is what the genetic material that the person inherited from the parents or from their lineage, their family. So that's one. Another risk factor are injuries that occur
Mm.
while the baby is still in the womb, which
Okay.
may affect the brain. It could be from infection. The mother could be infected, and then the infection can find a way to get into the baby. And
Mm.
the brain of a developing baby is very sensitive.
Gonna pick it up right there.
Yes, and it may contribute to the development of ADHD.
Okay.
Other risk factors that have been identified that people have talked about include cigarette smoking in a pregnant woman,
Mm.
excessive alcohol use in a pregnant woman,
Mm.
excessive alcohol use in a pregnant woman. So
Okay.
some of these things, even use of cannabis in a pregnant woman,
Mm.
some of these things have effect on a baby,
Oh yes.
on the growing brain.
Wow.
So these are some of the causes that are.
Mothers need to be careful then, depending also if it's genetic and all that. Wow. I think we lost her again. But what Dr. Faloye was trying to let us know is that the word causes cannot be used for any mental health issue. Like when I asked her what causes ADHD, she was trying to explain to us that instead of using the word cause, we should use risk factors. What are the risk factors? What could have led to this? So she explained to us about genetic disorder and genes, like picking up inherited genes. She also talked about pregnancy issues in pregnancy. It could be accident to the mom, of course, that affect the baby in the womb. And also, she was trying to talk to us about mothers using different in smoking and excessive alcohol during in pregnancy. So, Dr. Fale, we have you back. I was trying to recap on what you said previously before the connection before the
Went off.
internet discussion, yeah, before it went off. So of course, like we always hear other people talk about, oh, that's a punishment from God. That maybe the mom was bad, she had abortions and all that. That doesn't. What do
No,
you?
no, 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 no. All of those things are superstitious comments.
Mm,
It has nothing to do with. There are people who married as virgins,
mm-hmm.
never pregnant, never aborted, never whatever, no premarital whatever. They married their husbands. Their husbands were their first sexual partners, and they had children with ADHD.
ADHD. So that has to be eradicated in the society because most times when you talk to people and you try to create awareness as like example for special education, you keep hearing them, oh, why would I want to help? Because that was their sin. They committed it and God just punished them. So we need to understand in the society that it's not about that. So it may be
Yes, that's
all,
that's not
yeah,
right.
that's no, thank you. Thank you for letting us know that as well. At least coming from a doctor and an expert in this area, that should let people also know that it is not right. There's, the, in fact, it holds no water, and that is not God punishing
So,
people. And
no, it's not a wicked God that will be
exactly,
punishing people. And he will punish them by giving them children that have challenges. No, no,
exactly,
that's not.
exactly.
That's
So now, talking about adults, let's say we missed it when they were growing up, they were never diagnosed and all that. can they get diagnosed as an adult? And before they do, what are the symptoms or signs that you see to know if this adult needs to be diagnosed of ADHD?
Okay. Yeah, interestingly, somebody called me recently and was saying that, oh, she just got diagnosed of ADHD and she's almost in her 40s.
Wow.
In Nigeria. Oh, yes, I'm talking about last week. So I was pleasantly surprised when you came up with this topic that, wow, just in time. And, so mostly adults who have ADHD tend to have like inattention. They have difficulty focusing on a task. The hyperactivity may not be there. They may have a lot of inattention. They may have a lot of impulsivity. They just act without thinking things through. And then they are not able to focus on tasks. So you might find them changing jobs, changing ideas, and things like that. And then you may find them driving. And this particular person who called me says when she drives, she just drives like she's flying. So, and that's quite dangerous. They can just decide they are resigning their job. So inattention, impulsivity, you just, and then they may also have things like irritability. They get upset easily. They don't have bangs the door. They can just, every little thing. This person told me that it got so bad that if you, as much as just rub shoulders, like you mistakenly brushed her at work, she can almost hit you.
Wow.
Yes, but that's irritable. So those are some of the symptoms they can have.
So meaning that you were trying to say something.
And that also introduces a level of conflict in diagnosis because it will make it look like another condition. Yeah. Another thing they can have that people may miss is that because of those impulsivity and everything and the trouble they are having in keeping a job, in their relationships with people, they may also have features of depression. You can see that ADHD is not a small matter.
So meaning that we need to watch people around us and not just start quickly judging them. I think we lost Dr. Faloye again to the network glitches, but we're going to put this through, definitely. But of course, it means that we need to watch people around us. We need to see other adults and stop judging. If you don't know, don't judge. Like, for example, there are times in life or before now. I'm trying to say, like, I know that before now, people would, even me, when I see an adult acting, of course, with impulsivity or inattention, like, I'm quick to join them, like, this person is not serious. This person does not know what they're doing. But with what you've said today, it means that definitely this person may be going through a kind of developmental condition or challenges and they need help with it. So we should not be quick to judge people in our offices, even our spouses and children or other adults in our life. We should be very careful to judge. And is there any way, because I know mental health, I know all the challenges are difficult to communicate. So now, if I notice somebody in my household or in my community that may be thinking they have such challenges, how can I communicate it to them? How can I make them aware? Or like, how can we help as a community so that these people can go out and get diagnosed? Or is there any way, like medically or like for an expert, how have people been doing it to get people come over to get tested?
Okay, so that's a very useful question. It's very relevant. And I like that we are having this conversation. One of the ways we are going to be helping people is by having these conversations. We don't know where this video is going to get to. We don't know whose hands it's going to land.
Exactly.
So one of the first things is information. People need information. And that's why it's fantastic that you are doing what you're doing.
Thank you.
We continue to talk about it. And then for somebody that you know in your community, it will be awkward to just approach the person and start saying that I think this is what you have. So it would be nice to be friends with such person. People talk to people who they are comfortable with, people who they are friends with. So if you make friends with the person, because it's not an easy conversation to have with anybody, even outside of Nigeria. It's not an easy
Anywhere.
conversation to have anywhere. So you want to be friends with the person. You want to gain the person's trust. For the
Mm,
person to be able to have that kind of conversation with you, and
mm,
for you to be able to say, I think this is what might be wrong. I think these are the steps you should take.
mm.
And when you do that, you also want to go the extra mile of being available to support the person through the
Mhm.
journey.
That's true. And then maintain some level of confidentiality.
Exactly. You don't want to go around running your mouth about, do you know that Lagbaja just, and you mention him, or
Exactly.
you make it a WhatsApp gist. You
Exactly.
know what, you know how, exactly. So,
Yeah, of course. So people can even create messenger
a
and not
WhatsApp,
post on it. The
you
group
know,
on
after
it.
this, no.
Yeah.
And these are some of the reasons why people are afraid to
Come out.
say, come out. This thing, there's still a lot of stigma, and stigma is every country in the world.
Exactly.
Mental health conditions are still associated with stigma. So we need to be sensitive. We need to be empathic. You have to ask yourself, if the roles were reversed, would I want somebody running his or her mouth about my issues? How would I want to be treated? So those are
Exactly.
some of the ways as community, as individuals, we can help. In work settings, look, people are going through stuff. They're not just trying to be nasty. I think if
Mhm.
we have that kind of consciousness that this person it's not necessarily trying to be nasty. There just might be something wrong that they themselves don't even know.
Mm.
So we
Mhm.
need information, we need awareness, we need empathy to be able
Mhm.
to have these kinds of conversations with
Conversation
people.
with people. Exactly.
Yeah.
Thank you so much. So now, with we just talked about having that conversation with people, of course, building relationship, making sure they earn our trust, and keeping our mouth sealed. But the thing now is that I want to ask medically, and of course, I know as an educator, we base our, education plan for that child according to what the doctors and the therapists have, told us and what they have on paper. So medically, are there treatment? Is it possible to have ADHD as a child and maybe treating it does not develop into adult, or as an adult that just got it? Are there treatment or resources that can help people like that?
Oh, thank you. Yes. So treating ADHD is treatable,
Oh, good.
and there are medications, but medications are not enough
Mm-hmm.
because there are times that people have aggravation of their symptoms. That is not just because of the illness. There could
Mm-hmm.
be factors in their everyday life that is aggravating the symptoms.
Mm-hmm.
So, as much as possible, we use drug treatment, but you also have to work with the
Oh,
people who are the significant individuals in that person's life.
oh yeah.
So, treatment in childhood, a lot of times, improves as the child gets
But
older. If the child, so you may find out that some of the symptoms really reduce, and the person is able to cope and live normally like most other persons in adulthood.
mm-hmm.
Some of them have to continue the medications indefinitely
Mm.
for
Wow.
them to be able to function. But I
So
think that, yeah,
so meaning
some
that
of them do have to continue it indefinitely, yes.
So meaning that the first thing is trying early intervention and being consistent with the treatment as the child keeps growing.
Yes, because if we don't intervene early, the
Hmm.
possibility of that kind of child doing well in school would be very low. And a child who doesn't do well, even if it is not in school, for example, in Nigeria, if it is a child that they are put to go and learn to become an apprentice,
Mm-hmm.
there is nothing you want to do that does not require focus.
Exactly.
So if you have ADHD, focus is actually a problem because there will be inattention most times. So if you don't intervene early, that child will not be able to complete school, will not be able to learn whatever trade you want he or she to learn,
And,
and
and
automatically he or she cannot fend for self. when they grow older. So that's why early intervention, so that the individual can live as near to normal life as possible,
Exactly.
even up to adulthood, is
Adulthood.
very crucial.
Oh,
It's
thank
very
you.
crucial.
So meaning that even this recording, like you mentioned earlier, we don't know who's going to watch this video. So it's not just about people that have ADHD alone. Spouses need to be aware. Children need to be aware. Parents need to be aware so that when we see things like this, we can help. We have the information, we have the knowledge, and we're not just, jumping into conclusion, making unnecessary judgments, but we are using our knowledge to help people with such challenges, which will in turn help us as well. Because like now, if I know something and I understand what that person is going through, I can automatically bring myself to that level and help. But if I'm not aware, then before you know it, my own condition is coming out as well, because that will trigger stress, because I feel that person is
Definitely.
doing it to hurt me or doing it on purpose to hurt me or hurt other people. So awareness is
Yeah.
important. And that's why, of course, I don't think I have the ability to become a medical doctor, not to talk of a psychiatrist and all that. You've been doing so well and awesome, you know. And and I see that with what you just said as well. I just hope that in our country, the underdeveloped countries, African countries, that teachers, which are educators, can also see beyond what we see, what that child is. They should see the strength of that child, because teachers are also very quick to judge. Before you know it, they're already talking about maybe the family history of somebody, or the child will never change. You know, I want to use this opportunity to also talk to educators. We need to look beyond. We need to know that, because these kids are with us often, most of the time.
Exactly.
No? And then another thing that I notice is that I have friends, I have a lot of family members in Nigeria that the parents will always complain, oh, that teacher is always saying bad stuff about my child. Maybe as parents, we need to relax and hear the teachers out, because that
Yeah.
frustrates educators as well, because they're trying to tell you something, but you think they're picking on your child. So whether,
Interestingly, let me.
yeah. Oh, she was about to say something now then. And that's internet, the glitches. In case you don't know, Dr. Faloye called in from Nigeria. And of course, in Nigeria, we don't have regular lights like that, like we have in other advanced or developed countries. We don't have, internet can be glitchy at times, but you know what? We're trying to make it work. And this is just for us to know that people go through a lot of hardship, people go through a lot of pain to get information out. And this is just what she's doing with us tonight. She spent a lot of money getting that internet working at first. This is free. She's not getting paid for these services, but because of her passion and the need to put things out there, she has really done it to help us. So I hope she's going to come back in and try to talk to us. She was trying to give us an example of maybe something that happened between an educator and parents. So which, of course, will be very, very useful for this conversation. Again, while we're waiting for Dr. Faloye to call back in, I think she's back in right now. Dr. Faloye, can you hear me? Yeah, I think she's
Yes, I can.
good. You were trying to give us, maybe talk about something about parents and educators.
Oh, great. Yes, I was going to say that in childhood, to diagnose ADHD, actually, it has to happen in two settings at least, at home and in school. So you need to find out from both ends. And that is why the point you are making is very valid. If an educator is telling the parents that these are our observations about your child, and that keeps coming back to you as a parent, you need to pay attention. Because just like you said, there was this other day I was thinking, we take our kids to school at 8, for example. They are there till like 3 or 4, depending on where you are. And that's 8 hours. 8 out of 24. The remaining 8 hours they will spend sleeping. So the teacher actually, interestingly, probably knows your child a lot more than you probably do.
That's true.
So when the educator is telling you something, this is the first time, this is the second time, Mama, Papa, you got to take a look at that.
Exactly.
It's not time to start quarreling.
Exactly. At least try as much as possible to, remove every doubt. As long as you think it or you hear it, try. So what's the first call? If I have, like educators told me, I've been seeing my child with that, what's the first call? Where do I go to first? Who do I talk to? Who can test my child?
Okay, but I think that different countries have different health systems. I
Exactly.
understand that in a place like the US, when you have those kinds of complaints, the social worker will probably come to the school, take
Yeah.
a look at that child's school
We have the
setting.
diagnostician, we have, it depends, the special ed counselor, we have different people, there'll be referrers. Then they can now go to the psychiatrist or psychologist for a test.
Exactly.
Yeah. But how does it happen in Nigeria? Or, yeah.
Yeah. But in Nigeria, what in Nigeria, yes, in Nigeria, the quickest route would be to take the child to a pediatrician.
Okay.
Did you get that?
Yes,
So
to
of
take
course,
the child to the pediatrician first.
pediatrician. Yes. So perhaps you want to, and then because the pediatrician is a specialist too, except you are accessing that service in a private setting, you probably have to go through a general practitioner
Okay.
who will then refer. So a general practitioner can refer you straight to the child psychiatrist.
Okay.
Or the general practitioner refers you to the pediatric neurologist sometimes.
Okay. So there is parents, please know that there is help for that. There's help. So don't be lost. There are professionals work that do that job, that they've been trained to do it. So don't stay home and say, somebody use this medication, I can try it. Make sure you get the expertise of a professional, of someone in that line. Child pediatrician, your general practitioner that can refer you to a child psychiatrist, or to a doctor that can help your situation and diagnose the child first. So, Dr. Faloye, what if it's an adult? Let's say an adult, I just realized that something is wrong. Where do I go?
Okay, so just the same way,
Okay.
if you can access the services of a psychiatrist directly, you can actually go directly. But if not, you may want to go to your general practitioner who then refers you to a psychiatrist.
Oh,
so I mean, those are the pathways.
okay.
Those are the pathways, because largely for the treatment, you require a prescription, apart from other manipulations, environmental manipulations, and lifestyle manipulations. But usually medication is required. And in Nigeria, for example, mental health team that have prescription rights.
What did you say?
Mental health team. I said in Nigeria, for example, as of today, within the mental health team, only psychiatrists have prescription rights.
Okay, so meaning that don't just go get prescription from anybody. If you're in Nigeria, please make sure a psychiatrist is the one prescribing. And how about people that will say they are using traditional medicine? I think we lost, can you hear me? Because some people will say, oh, I have traditional medicine that can help. What would you say to things like that? I think we lost her again, and I was trying to get in there because I know a lot of us, they say, oh, there's alternate medicine, there's traditional medicine. If I mix this and mix that, this child will calm down, this child will be good. But I just want us to sit at the medical as from the expert's view and what's been going on, because I know they would have to come back to treat some people that have gone through that route, and they are back also in the, they had to come back into the system to get it done. So I really want Dr. Faloye to come back with us so she can explain to us, does traditional medicine work? Is it advisable? Dr. Faloye, I see you're back. So I was trying to ask, does traditional medicine work? Because I know
this network is not good.
Yeah. Did you hear my question?
That does traditional medicine work?
Yes.
Well, traditional medicine is not even the only thing we have to worry about.
Mm-hmm. Oh, now we lost you again. I always like to talk about traditional medicine and
praying about.
Yeah, we lost you. So if you can start again, you were trying to say traditional medicine is not the only thing to worry about. Hello, Dr. Faloye. Are you there? Yeah, I think she's going to come back in a little. I'm so sorry for this, but you know what? We were going to try to get it done. And definitely that is what we do as Pet every day. We are not going to stop till it gets out there to the world and people can use the opportunity to help others and to, that's why I always say share this information. You never can tell who needs it, even us personally. Even for me, talking about it, there are some parts, some things I can learn. For example, using the word what caused ADHD. Before now, even though I know about risk factors and all that, but there are things that we need to understand. And I think I'm having Dr. Faloye back again. If the internet is better now, can you hear me?
Oh, yes, I can.
Yes, we're trying to, you said traditional medicine is not the only thing to worry about.
Yes, we have to worry also about people who spend time drinking holy water and praying and not seeking medical help.
Truth.
I see that all the time.
Praying on the child is going to change.
Yes, I don't have a problem with prayer.
Exactly.
But I do not think that prayer stops us from taking medical solutions, taking up medical solutions.
Exactly.
The challenge with traditional medicine on its own part is that some of this stuff interact with drugs that we will use. Mm-hmm. Some of this stuff can damage the liver. Some of these things can damage the kidney. And you wouldn't know. They tell you that gogo nishe, like in our Yoruba people would say, everything how can one thing cure everything? How can one thing work for everything? That stuff even defies logic. So let's be very careful with our traditional preparations, herbal concoctions, and the like.
Yes.
They do more harm than good in most people. And for those of us who are religious inclined, look, your prayers do not stop medical treatment.
Exactly. Thank you.
They don't stop each other in any way, please.
Thank you.
For the sake of individuals, let's take up medical help and pray. God is a good God.
Yeah, I believe in God too. I believe in miracles, but while doing that, your faith, you have to put work in your faith. You need to take care of yourself. We have experts doing this because God wants them and giving them that knowledge as well to be able to help us, and which is what we clamor for as well at Spedeveryday. So I don't want to take too much of your time. I know it's been glitches there, glitches here, but honestly, I want to say thank you so much for being here with us today. And to my audience, I want to say thanks for watching. I know it's a lot of glitches, but I'm going to try as much as possible not to edit any part because every part is relevant. But just try and patiently watch with us. I know for you to even be hearing what I'm saying now, it means you've patiently watched till the end. Thank you so much, Dr. Faloye. But before you go, is there any parting word, anything you want to say generally concerning ADHD, mental health? And then I want you to know that I'm going to introduce you to my friend, Dayo. She has a Facebook live videos as well, sessions all the time, and it's called My Mental Health Matters. I'm sure if she watches this video, she'll be going all the way crazy about it and she'll want to speak to you. So please expect.
I'll be glad.
Thank you.
I'll be waiting. I'll be glad. That'll be great. Yes. So I would like to just say and remind people again, like I always say, there is no health without mental health. And there is ability in disability. So let us take our mental health very seriously, and there is nothing to be ashamed of. Thank you.
Thank you so much. To all my subscribers, thank you again. Remember to share this video after watching and subscribe. And not just subscribing, but click on the notification bell so you can always get the latest episode of Spedeveryday. And once more, I want you to know that Spedeveryday is going to be coming live at Spedeveryday Yoruba very soon. Watch out for that. I love you. And all right, thank you, Dr. Faloye.
Bye.
Bye.